Hello, my name is Ashley Thompson, and I will be doing my presentation today on lung cancer. I'm just going to talk about some different causes, the different types of lung cancer, some symptoms that you may want to look out for. What exactly is lung cancer? Lung cancer is also known as pulmonary carcinoma or carcinoma of the lung. The disease is characterized by an uncontrollable cell growth subsequently causing tumors or masses within the lungs. And this here is just an x-ray of a mass within, looks like the right lung. You can see the cancer is highlighted. How does it affect the respiratory system? The organs known as the respiratory system are comprised of the trachea, the larynx, and a set of bronchi. This set of bronchi then branch off into smaller sets of bronchi, and then finally branch off into bronchioles. At the end of the bronchioles are tiny air sacs called alveoli. The alveoli inflate during inspiration, allowing the absorption of oxygen to occur. During expiration, the alveoli shrink, expelling out the waste within the lungs. When someone has cancer due to tobacco use, these alveoli lose their elasticity, ultimately causing the tiny air sac to fill with pollutants. Once these tissues become malignant tumors, they lose all function and are unable to help cleanse the lungs. And this here is just a picture of what would a smoker's lung look like compared to someone who does not smoke. As you can see, there is a huge difference. Here again is another picture of a smoker's set of lungs versus a healthy set of lungs. Another part of the body that is affected within the lungs are the cilia. The cilia are the small hair-like projectiles that help sweep out pollutants. These small hairs also help prevent infection by continuously moving out dirt and debris. Once these tissues are damaged, the lungs are no longer able to remove the unwanted pollutants such as smoke, dust, or debris. Once these pollutants remain in the lungs, the cells start to mutate, causing carcinomas. Types of lung cancers. Lung cancer is categorized into two different types. These two types are small cell lung carcinoma and non-small cell carcinoma. Small cell carcinoma accounts for 10 to 15% of lung-related cancer. SCC is also known to be the most aggressive type of cancer. Non-small cell is the most common type of lung cancer. NSCC can be broken down into three subcategories. Adenocarcinoma is the most prevalent. Although this subgroup usually is related to tobacco use, it is also found in non-smokers as well. These particular carcinomas form on the outside edges of the lungs. This type of cancer will usually metastasize to other regions of the body, such as the lymph nodes. Squamous cell carcinoma is usually located in the central region of the chest and the bronchi. Large cell carcinomas are the least common, however, they still have a tendency to spread to other organs within the body. How is it caused? Smoking is the number one related factor attributed to lung cancer according to the National Cancer Institute. Although most times tobacco use is a factor, it can also be an enabler of other pollutants that form the lung cancer itself. There are various toxins that we are exposed to that heighten our risks of lung cancers. Pollutants in the air, such as car exhaust, can be hazardous according to the American Lung Association. Exposure to the certain chemicals over a prolonged period of time can also result in lung cancer. Some of these toxins include asbestos, arsenic, uranium, nickel, and some petroleum products. Radon has been classified as the number 2 cause of lung cancer, according to the U.S. Environmental Protection Agency. Radon is a radioactive gas that is comprised of decaying elements such as uranium. These odorless, tasteless gases are inhaled, producing radioactive particles within the lungs. These particles in turn destroy the lungs over a prolonged period of time. This is the only cancer proven to be related to inhalation of radon, according to the CDC. Inhalation of bleach cleaner products over time can also burn the vital tissues within the lungs and should be avoided. If you cannot avoid these products, be sure to at least wear a proper mask when using them. Symptoms. Lung cancer typically doesn't cause signs and symptoms in its earliest stages. Signs and symptoms of lung cancer typically occur only when the disease is advanced, according to the Mayo Clinic. There are a few key symptoms to notice when one is suspecting lung cancer. These symptoms include, but are not limited to, hoarseness, persistent cough that does not go away, red-tinged or rust-colored sputum, shortness of breath, wheezing, bone pain, headache, and losing weight without trying. Additional things to monitor. If lung cancer spreads to different organs, it can cause other symptoms as well. Bone pain can indicate that lung cancer has metastasized. Nervous system changes such as numbness or weakness to an extremity can indicate the cancer has spread to the spinal cord and will likely cause additional issues. Yellowing of the skin and eyes, known as jaundice, is present when the cancer has spread to the liver. Cancers of the top part of the lungs are called Pancoast tumors. These tumors may damage a nerve that passes from the upper chest into the neck. This can cause severe shoulder pain. Sometimes these tumors can affect certain nerves to the eye and part of the face, causing a group of symptoms called Horner syndrome. Although the effects of lung cancer are usually seen late stages, there are a few symptoms that can be related to early lung cancer development. These consequences include fluid buildup on the lungs. This fluid is very hazardous to one's health simply because the fluid may eventually move cancerous cells along. Wheezing and shortness of breath are almost immediate when lung cancer is onset. Some consequences in the long term are the need for oxygen, possible surgeries or other treatments, and risk of the cancer metastasizing to other organs of the body. And this is just a photo of what it would look like for the fluid to fill up in the tiny air sacs in the lungs. This is actually a picture of pneumonia. Surgical treatment. When it comes to treatment of lung cancer, there are a multitude of options. The particular type of treatment that is suited best for a client varies from person to person. Everyone is unique, just as the diagnosis. Although two people may have lung cancer, it will affect them differently based on varying biological factors. One option for treatment is surgery. This involves the removal of the lung tumor along with the diseased part of the lung. A wedge resection is a removal of a wedge-shaped part of the lung that is surrounded by cancerous cells. A lobectomy is the removal of the lobe of the lung. A bilobectomy is when two lobes of the lung are removed. When the entire lobe of the lung is removed, this is called an immunonectomy. Chemical treatments. Chemotherapy involves the use of powerful drugs that are intended to eradicate cancer cells. This is usually a combination of several different drugs. Chemotherapy can be used as a main treatment or in addition to other treatments. Chemotherapy can often shrink tumors before subsequent treatments are to take place. It can also be used later on in advanced stages to relieve some symptoms of the cancer. These drugs are usually given orally as an IV infusion. Side effects of this treatment can include hair loss, nausea, vomiting, fatigue, and loss of appetite. Radiation therapy uses powerful high-energy X-rays to kill cancer cells or keep them from growing. Radiation may come externally or from radioactive materials placed directly inside the tumor itself. Radiation can also be used to shrink tumors or used after surgery to kill off any remaining cancerous cells. Precautions to take. There are many precautions one can take when trying to avoid lung cancer. Smoking cessation is the highest regarded preventative measure. Avoiding secondhand smoke and testing your home for radon care, also deemed as preventative measures. Avoiding carcinogens and having a healthy lifestyle can lower risks as well. And thank you. I hope you enjoyed my presentation on lung cancer.